Today, we're diving into a topic that affects millions of people around the world: joint pain. Whether it's arthritis, inflammation, or stiffness, what we eat plays a major role in how our joints feel and function. Many people try medicines, supplements, and exercises, but often forget one critical truth. You can't heal inflammation if you keep feeding it. Yes, certain foods can silently worsen joint pain, making your bones weaker and your mobility limited. So, let's talk about what you should never eat if you want lasting relief from joint pain. First, processed sugars. These are the biggest culprits. Sugary drinks, pastries, and candies trigger inflammatory chemicals called cytokines that directly attack your joints. Second, refined carbs like white bread, pasta, and rice quickly turn into sugar in your body, worsening inflammation. Third, fried and junk foods. Oils used in fast food are full of omega-6 fats that imbalance your body's omega ratio, leading to pain and swelling. Fourth, red and processed meats contain saturated fats and compounds like advanced glycation end products that stiffen your joints and inflame your tissues. Fifth, dairy products, especially full fat cheese and milk, can irritate the joint lining in sensitive individuals. And finally, alcohol and soda both dehydrate your body, weaken cartilage, and increase uric acid, which leads to more pain, especially in gout sufferers. So, if you truly want to find relief, remember this golden rule: heal with food, don't hurt with food. Replace these harmful items with anti-inflammatory alternatives like leafy greens, berries, olive oil, fatty fish, nuts, and turmeric. Your joints deserve care from the inside out. Eat smart, move more, and stay pain-free, because every healthy bite is a step toward a more active, comfortable life. Processed sugars trigger inflammation and worsen joint pain. This is one of the most overlooked truths about diet and chronic pain. When you consume foods or drinks high in refined sugar, such as soft drinks, pastries, candies, desserts, or even sweetened breakfast cereals, your body immediately reacts by releasing inflammatory chemicals known as cytokines. These cytokines act as messengers in your immune system, and when they are triggered too frequently, they can lead to chronic inflammation, a major factor behind joint pain, swelling, and stiffness. What seems like a simple sweet craving can actually fuel long-term discomfort in your joints, especially for people already dealing with arthritis or osteoarthritis. Sugar not only causes inflammation, but also increases the body's production of advanced glycation end products ages. These harmful compounds form when sugar molecules attach to proteins and fats in your body, damaging tissues and making them less flexible. When this happens to your joint cartilage, the smooth cushion that prevents bones from rubbing together, it starts to wear down faster, leading to more friction, pain, and stiffness. Over time, high sugar intake can accelerate the breakdown of cartilage and delay your body's natural repair processes, leaving your joints weaker and more prone to damage. Another serious issue with sugar consumption is its effect on insulin and blood glucose levels. Every time you consume refined sugar, your blood sugar spikes rapidly, forcing your pancreas to release more insulin. These repeated spikes and crashes can cause low-grade inflammation throughout your body. And since the joints are already vulnerable areas, especially in people who are overweight or aging, this constant inflammation makes them the first to show symptoms of pain or stiffness. Sugar also contributes to weight gain, which puts extra stress on your joints, particularly the knees, hips, and lower back. Just a few extra pounds can significantly increase the pressure on your joints with every step you take. This creates a vicious cycle. Excess weight leads to joint pain, and joint pain makes it harder to exercise, which then leads to even more weight gain. To manage or prevent joint pain effectively, reducing sugar intake is crucial. Replacing sugary snacks with natural options like fruits, nuts, or yogurt can make a big difference. These foods satisfy sweet cravings while providing antioxidants that fight inflammation, helping your joints stay healthy, flexible, and pain-free. Refined carbohydrates like white bread and pasta quickly turn into sugar, increasing stiffness, a hidden danger that many people overlook when trying to eat normal, everyday foods. When you consume refined carbs, such as white bread, white rice, pastries, or traditional pasta, your body rapidly breaks them down into glucose, which causes a sharp rise in blood sugar levels. This sudden spike triggers the release of insulin, and just like with processed sugar, the body responds with an inflammatory reaction. Over time, this continuous pattern of sugar spikes and inflammation can significantly worsen joint stiffness, swelling, and overall discomfort. Refined carbohydrates lack the natural fiber, vitamins, and minerals that whole grains provide. Fiber acts like a slow release mechanism, allowing glucose to enter your bloodstream gradually. But when fiber is stripped away during processing, your body absorbs these carbs much faster, leading to higher insulin levels and promoting the production of inflammatory molecules such as C-reactive protein CRP. Elevated CRP levels are commonly found in people suffering from arthritis and chronic joint inflammation, indicating that what you eat directly affects how your joints feel. Another problem with refined carbs is that they encourage fat storage, particularly around the abdomen. Excess belly fat isn't just a cosmetic concern, it acts like a mini factory producing inflammatory chemicals called adipokines. These chemicals circulate through the body and worsen inflammation in your joints, making them stiffer and more painful. This connection between refined carbs, weight gain, and inflammation creates a cycle that can be difficult to break if dietary changes are not made in time. Moreover, consuming too many refined carbohydrates can also alter your gut microbiome, the balance of healthy bacteria in your digestive system. A disrupted gut microbiome can lead to increased intestinal permeability, often called leaky gut, allowing toxins and undigested food particles to enter the bloodstream. This triggers an immune response that further fuels inflammation in various parts of the body, including the joints. People who frequently eat foods made with white flour, processed grains, or sugary breakfast cereals often notice joint stiffness, morning discomfort, or reduced flexibility. Replacing refined carbs with whole grains such as oats, brown rice, quinoa, and whole wheat can stabilize blood sugar levels, reduce inflammation, and improve overall joint comfort. These slowed digesting carbs provide steady energy while protecting your joints from the painful effects of chronic inflammation. Fried and junk foods contain unhealthy oils that promote swelling and inflammation, a reality that many people underestimate while enjoying their favorite fast food meals or snacks. Most fried foods, including French fries, fried chicken, burgers, chips, and packaged snacks, are cooked in refined vegetable oils such as corn oil, soybean oil, or sunflower oil. These oils are high in omega-6 fatty acids, which, when consumed in excess, disturb the body's natural balance between omega-6 and omega-3 fats. While the body does need some omega-6 for normal function, too much of it triggers the production of inflammatory chemicals that directly contribute to swelling and joint pain. Another major issue with fried foods is the formation of trans fats. These are artificial fats created when hydrogen is added to vegetable oils to make them more stable and extend shelf life. Trans fats are extremely harmful. They raise bad cholesterol LDL, lower good cholesterol HDL, and increase systemic inflammation. The more often these fats are consumed, the higher the risk of developing chronic inflammatory conditions like arthritis, gout, or rheumatoid pain. Over time, regular consumption of fried and processed foods can weaken the cartilage and synovial fluid in the joints, causing stiffness, swelling, and pain even during light physical activity. Junk foods are also filled with preservatives, additives, and artificial flavorings that can irritate the body's immune system. These substances often act as hidden toxins, leading to oxidative stress, a process that damages cells and tissues, including those in your joints. When oxidative stress and inflammation combine, they accelerate the breakdown of collagen, which is essential for maintaining joint elasticity and cushioning. The result is more friction between bones and an increased risk of chronic pain. Moreover, fried foods are calorie-dense and nutrient-poor, leading to weight gain, which puts extra mechanical stress on joints. Every extra pound adds pressure to your knees, hips, and ankles, worsening inflammation and discomfort. People who frequently eat fried foods often notice symptoms like morning stiffness, tenderness in the knees, and reduced flexibility due to this combination of inflammation and excess body weight. Switching from fried and junk foods to healthier cooking methods like grilling, baking, or steaming can make a remarkable difference. Using anti-inflammatory oils such as olive oil or avocado oil, along with adding omega-3 rich foods like fish, walnuts, and flax seeds, helps restore balance in the body, reduce swelling, and promote healthier, pain-free joints. Red and processed meats contain harmful fats and AGE that damage joint tissue, a fact often ignored by those who consume meat regularly without considering its long-term effects on inflammation and pain. Red meats such as beef, lamb, and pork, as well as processed varieties like sausages, hot dogs, and bacon, are high in saturated fats. These fats stimulate the body's inflammatory response, especially in people with existing conditions like arthritis. When the body digests these fats, it releases inflammatory compounds that attack the joint lining, causing swelling, stiffness, and increased pain over time. Processed meats are even more harmful because they contain preservatives like nitrates and nitrites, which can further promote oxidative stress in the body. Oxidative stress occurs when there's an imbalance between free radicals and antioxidants, leading to cellular damage. In the joints, this oxidative stress weakens cartilage, the cushion that allows smooth bone movement and makes it more prone to wear and tear. Over time, the joint surfaces become rough, leading to friction, inflammation, and discomfort during movement. Another harmful element found in red and processed meats is AGE advanced glycation and products. These compounds form when meat is cooked at high temperatures, such as grilling, frying, or barbecuing. AGE build up in the body and bind to tissues, making them stiff and less elastic. When they accumulate in the joints, they damage collagen and cartilage, two vital components that maintain flexibility and shock absorption. This process not only worsens existing joint pain, but also accelerates degenerative conditions like osteoarthritis. Additionally, red and processed meats are known to increase levels of uric acid in the blood. Elevated uric acid can form crystals that deposit in joints, causing intense pain and inflammation, a condition commonly known as gout. People who frequently consume these types of meat often experience joint swelling, tenderness, and reduced mobility, especially in the knees, ankles, and toes. Reducing the intake of red and processed meats can significantly improve joint health. Replacing them with lean protein sources such as fish, chicken, lentils, beans, or tofu provides the body with essential amino acids without the inflammatory effect. Fatty fish like salmon or sardines are particularly beneficial because they contain omega-3 fatty acids, which help combat inflammation, protect cartilage, and promote overall joint flexibility and strength. Dairy and alcohol can irritate joints, increase uric acid, and cause dehydration, a combination that can significantly worsen inflammation and discomfort in people dealing with joint pain. Dairy products like full-fat milk, cheese, butter, and cream contain saturated fats that may trigger inflammation in sensitive individuals. These fats can stimulate the production of inflammatory markers in the body, aggravating pain and stiffness in the joints. Some people are also lactose intolerant or have mild sensitivities to the proteins found in dairy, such as casein. When the body reacts to these proteins, it releases histamines and other immune compounds that can irritate the joint lining, leading to swelling and discomfort, especially in people with arthritis. In addition to fat content, many dairy products undergo heavy processing that strips away beneficial enzymes and nutrients, making them harder to digest. This poor digestion can create a buildup of acidic waste in the body, contributing to inflammation and joint soreness. For individuals already suffering from chronic pain or autoimmune conditions, consuming dairy regularly may intensify symptoms and make recovery slower. Replacing full-fat dairy with plant-based alternatives like almond milk, soy yogurt, or oat milk can help reduce inflammation while still providing calcium and vitamin D, which are essential for bone health. Alcohol, on the other hand, poses a different but equally harmful threat to joint health. Regular alcohol consumption dehydrates the body by increasing urine production and reducing the body's ability to retain essential fluids. Since joints rely on fluid and lubrication to function smoothly, dehydration can cause them to become dry and stiff, leading to pain and limited mobility. Alcohol also raises uric acid levels in the bloodstream, which can crystallize in the joints, especially in the toes and ankles, leading to sharp, severe pain associated with gout. Furthermore, alcohol interferes with nutrient absorption, reducing the body's ability to utilize essential vitamins and minerals such as vitamin C, calcium, and magnesium, all of which play key roles in maintaining strong bones and flexible joints. Over time, excessive drinking can weaken the cartilage, slow tissue repair, and make inflammation more persistent. For those seeking joint pain relief, reducing or eliminating alcohol intake can bring noticeable improvement. Staying hydrated with water, herbal teas, or fresh juices supports joint lubrication, while avoiding dairy and alcohol together can significantly decrease inflammation, stiffness, and overall joint discomfort. Healthier alternatives like fruits, vegetables, omega-3 fats, and turmeric can reduce inflammation, naturally offering one of the most effective and sustainable ways to relieve joint pain without relying solely on medication. The foods we choose every day have a direct impact on how our body manages inflammation, and choosing anti-inflammatory options can protect joint tissues, improve mobility, and restore comfort over time. Fruits and vegetables are rich in antioxidants, vitamins, and minerals that neutralize harmful free radicals responsible for damaging joint cells. Brightly colored produce such as berries, oranges, spinach, kale, and broccoli are especially powerful because they contain compounds like vitamin C, beta-carotene, and flavonoids that support collagen production and help rebuild cartilage. Omega-3 fatty acids, found in foods like salmon, sardines, flax seeds, walnuts, and chia seeds, play a crucial role in reducing inflammation at the cellular level. Unlike omega-6 fats found in processed foods that trigger inflammation, omega-3s balance the body's immune response, reducing swelling and pain in the joints. Regular consumption of omega-3 rich foods can decrease stiffness in people with arthritis and improve flexibility in those experiencing chronic joint pain. These healthy fats also enhance lubrication within the joints, allowing smoother movement and preventing the grinding and friction that cause discomfort. Turmeric, often called nature's anti-inflammatory spice, contains a powerful compound called curcumin. Curcumin works by blocking inflammatory enzymes and pathways in the body, helping to ease pain and stiffness naturally. Adding turmeric to meals, teas, or smoothies can provide noticeable relief, especially when combined with black pepper, which boosts curcumin absorption. Studies have shown that turmeric can be as effective as some anti-inflammatory drugs, but without harmful side effects, making it an excellent long-term dietary choice for joint health. Other natural helpers include nuts, seeds, olive oil, and green tea, all of which contain anti-inflammatory and antioxidant properties that help protect joint tissues from damage. Hydrating foods like cucumbers, watermelon, and citrus fruits also support joint lubrication and flexibility. By consistently including these natural foods in daily meals, the body becomes better equipped to repair tissue, manage inflammation, and maintain overall mobility. Shifting from processed and inflammatory foods to a diet centered around fruits, vegetables, omega-3s, and turmeric can gradually restore comfort, reduce pain, and help keep your joints strong, flexible, and healthy for years to come.